Morning everybody. This is Dr. Ranjan Agrawal and today we will be covering the lecture on gastric cancer or gastric carcinoma. Now we all know that there are multiple tumors which can occur in the stomach. They could be benign, they could be malignant. The reason why I have included polyps in a separate category is polyps could be benign, the polyps could be malignant. And there are few polyps which are pre-malignant. This means they are likely to turn into a malignant pathology sooner or later if not treated within the stipulated time. So under the benign we have adenomas and GIST. What is GIST? Gastrointestinal stromal tumors. Under the malignant, the most important being adenocarcinoma. Then from the stromal area, we can have the leiomyosarcoma arising from the soft tissue, a malignant tumor, a carcinoid, or lymphomas. Coming to carcinoma of stomach, we know that the incidence is higher in Japan, China, and one more interesting country is Nepal, where you have a higher incidence of carcinoma stomach. The reason why this carcinoma is higher in incidence in Nepal is what they do is they have a different type of eating habits. Once they go to the jungle or to a higher area and they kill an animal, they chop it into small pieces, coat it or marinate it with some chemicals, and they hang it in front of their houses to dry. And gradually they consume it in their diets. Now what happens is after marination there are certain changes which occur in the meat and this leads to release of certain chemicals etc. which changes the GI environment and this leads to a malignancy. In the developed countries this incidence is reported to be low, especially in USA and in the United Kingdom. When we deal with pathogenesis, there are multiple factors, especially the environmental factors, which play a vital role. Diet is very, very important in this situation, where nitrites or smoked food, they constitute an important cause. Unfresh or these frozen type of materials, like fruits, vegetables, they also are predisposing to the carcinoma. Too much of spice in the food, high intake of salt, low intake of green leafy vegetables, low citrus fruits, and low animal fats are other important factors. In the host, if the patient is suffering from chronic atrophic gastritis, there is a high incidence of carcinoma stomach. Hypochlorhydria, which usually results because of H. pylori. Patients who have undergone partial gastrectomy, this means not the complete but a small segment of stomach being removed. So now what happens is the surface area of stomach is reduced. So there is a disturbance in the acid, mucin production and all, and this leads to an higher incidence of carcinoma stomach. Then we have already dealt with gastric adenomas. Smoking and alcohol are important factors. Now when we talk about tobacco, it could be a smoke, it could be into a juice in the form of edible tobacco, which people usually stuck under their gums, and the juice which is extracted from them, it leads to carcinogenic elements.